Today we're gonna talk about anemia. It's gonna be a long topic. We might take 2 3 days. Anemia is a condition in which you lack enough healthy red blood cells to carry oxygen to your body's tissues. It can make you weak and tired. There are many forms of anemia, and each with its own causes. Anemia can range from mild to severe. See your doctor when you experience anemia. Eat healthy and exercise to prevent anemia. There are 5 types of anemia that we will cover: aplastic anemia, iron deficiency anemia, sickle cell anemia, thalassemia, and vitamin deficiency anemia. Depending on the causes of your anemia, symptoms occur. Sometimes there are no symptoms if your anemia is mild, but if they occur, it is fatigue, weakness, pale or yellowish skin, irregular heartbeats, shortness of breath, dizziness or lightheadedness, chest pain, cold hands and feet, headaches. Symptoms worsen as anemia worsens. Make an appointment with your doctor if you are fatigued. It's not necessary to have anemia if you are fatigued because there are many causes besides anemia. But if you are low on hemoglobin, which is a protein in your red blood cells that carries oxygen to your body's organs and tissues and transports carbon dioxide from your organs and tissues back to your lungs. So, if you are low on hemoglobin, you must make an appointment with your doctor. Anemia occurs when your body doesn't have enough red blood cells. This can happen if your body doesn't produce enough red blood cells. Bleeding causes you to lose red blood cells. Your body destroys red blood cells due to an autoimmune problem in which the immune system mistakenly sees your own red blood cells as foreign substances and destroys them. Give me a second.
Okay, while Rayan is figuring things out, um, I would just like to recap that yesterday when we talked about um, kidney disease, we talked a bit about anemia and how anemia can be both a cause of kidney disease because red blood cells don't supply your kidney with proper oxygen, and so it affects your kidneys, and kidney disease um, cause um, can also cause anemia, in which when you don't filter out the blood, you lack a lot of red blood cells to supply oxygen. There's a lot of waste and problems that may cause shortage in red blood cells. Does any questions so far on the topic? I don't think so.
Okay, let's continue. I just removed the background noise. So, there are 3 types of blood cells: white blood cells, which is related to the immune system, it fights viruses; the platelet, which helps your blood and red blood cells to carry oxygen throughout your body; and the red blood cells, which contains hemoglobin, an iron-rich protein that gives blood its color. It enables red blood cells to carry oxygen from your lungs to all parts of your body and to carry carbon dioxide from other parts of the body to your lungs to be exhausted. Most blood cells are produced by your bone marrow. To produce hemoglobin and red blood cells, your body needs iron, vitamin B12, folate, and other nutrients from the food you eat. Muhammad,
It's lagging a bit. I'm waiting for the slide to come. Okay, there. Okay, so what are causes of anemia? One big cause which is the most common, is iron deficiency. One second. It's iron deficiency. Uh, Iron is your bone marrow needs iron to make hemoglobin, which is the main component of red blood cells. And if you have inadequate iron, your body can't produce enough red blood cells, and you end up with a shortage. This type of anemia mainly occurs to pregnant women because they need a lot of it. It's for their child. It's also caused by blood loss. Because when you have blood loss, you need more iron. Either from heavy bleeding, ulcer, cancer, or some over-the-top pain relievers, such as aspirin. If you use too much, you end up with iron deficiency. And vitamin deficiency. Your body needs to folate, vitamin B, to produce enough healthy red blood cells. Vitamin B12, this is present in a lot of foods such as fish, red meat. I don't know. There's a lot of foods that contain this. We will talk about them later. But you need them to produce healthy red blood cells. Any diet lacking can cause a decrease in production. Some people who consume enough B12 aren't able to absorb vitamin. It's just like it's a similar condition to diabetes. Like your glucose is there, the energy you need is there, but you can't use it because of a lack of insulin. It's just kind of the same thing, but with B12 vitamins. Your body cannot use them properly, and this is called pernicious anemia, when you can't use your B12 vitamins. Next slide. Another cause of anemia is anemia of inflammation. This is usually caused by cancers, HIV/AIDS or HIVs, rheumatoid arthritis, kidney disease, as we talked about, Crohn's disease, and other inflammatory diseases. Basically, any disease that interferes with the production of red blood cells will cause anemia, because then you lack red blood cells. Aplastic anemia. This is rare, but this is the most dangerous. It's when there's your bone marrow has a problem. It's not producing. It's not like it's no deficiency, no anything. It's just there's something wrong with your bone marrow, whether it's an infection, viral or not viral. Certain medicines that attack bone marrow, autoimmune disease. And this, I really want to do this topic soon. And certain chemicals. And another cause is anemia associated with bone marrow disease. A variety of diseases, mostly cancers, such as leukemia and myelofibrosis. They have the problem in the bone marrow. Hemolytic anemias. This group of anemias develops when red blood cells are destroyed faster than bone marrow. It's just like blood loss. What happens is your body destroys the red blood cells. There's a disorder, and then your body destroys your red blood cells, and you end up with a lack of red blood cells. This is present mostly for older people. As you age up, this happens more often. And sickle cell anemia, maybe you have heard the name before. As you can see, that this inherited and sometimes serious condition is a hemolytic anemia. It's caused by a defective form of hemoglobin that forces red blood cells to assume an abnormal crescent shape. So basically, hemoglobin forces the red cells that there's a problem, and you end up with bad blood cells. Basically, your blood cells don't operate properly and they die really quickly, and you end up with a shortage. Any questions so far? All good? Yes. Okay, next slide. Okay, there's some risk factors that play in on anemia and that you have to look out for. First of all, this is the thing that I think all of you can control, which is a diet lacking in certain vitamins and minerals. As we said before, iron and vitamin B12 are the most important to take. Make sure that your diet contains at least one meal that contains this, whether it's fish, red meat, milk, nuts, anything that contains this is good for you, and it will hopefully help your bone marrow produce more blood cells. Intestinal disorders. This is when your digestive system doesn't absorb the nutrients properly, and then your bone marrow can't use them. You end up with a blood deficiency. Menstruation and pregnancy. It's in women. It's mainly caused pregnancy. I don't think any of you guys are women, so I think we could skip those. Chronic conditions. This is basically any disease or condition that you have that may put you at risk. Some are cancer, kidney failure, diabetes. These are just such examples. These put you at a risk of chronic anemia. You could look up a list of all of the diseases that put you in such risks. Slow chronic blood loss from ulcer or other sources within your body can deplete your blood store of iron. So if your body overuses the iron, it can cause problems. Family history. If you have any inherited anemia disorders, that could be a problem. Sickle cell anemia is one of them. Other factors, which is listed here. History of certain infections, blood diseases, autoimmune disorders, alcoholism, exposure to toxic chemicals, medications that affect blood cell production. So a lot of medications, you need to look out for the side effects, because this could be a dangerous side effect, and side effects can be dangerous. So don't take any medication there is. And age, because when you age up, you're just more prone. Next slide. All right. Yeah. Okay. Complications. After you have been diagnosed with anemia, these are the things that are probably going to pop up. Severe fatigue. You're going to get tired easily. One, because any disease causes fatigue, and second of all, it's especially near your bones and bone marrow, so you're gonna get tired easily. Pregnancy complications. I don't think we need to go to that a lot. Heart problems. This thing is kind of interesting because when you don't have red blood cells, your heart has to work extra hard to pump out blood to the rest of the body, because you have a shortage and the rest of your body is not getting enough oxygen. And let's say, for an example, when you're playing soccer or football, any sport, and you play for 4 hours continuous, you're gonna get tired, and you're probably gonna have deficiencies and everything, because you're overworking your muscles. Same thing with the heart. You have a lack of blood, so your heart has to work extra hard. It's exercising too much, and so you're gonna have heart problems and death, because it gets to a severe stage, and then you die. Yeah. Next slide. This is also me.
Yeah.
Oh, okay. Many types of anemias can be prevented, but to avoid iron deficiency anemia. So basically, the main thing that you can do is get the nutrients necessary in order for you to produce valid amount of red blood cells. Such nutrients are iron, as we talked about. These foods that contain iron are beef and other meats, beans, lentils, iron fructate cereals, which is like bread, rice, oats, dark green leafy vegetables, and dried fruits. Another thing that you need to make sure that you intake is folate. This nutrient and its synthetic form, folic acid, can be found in fruits, fruit juice, dark green leafy vegetables. I think like spinach or something like that. Green peas, kidney beans, peanuts, and enriched grain products such as bread, cereal, pasta, and rice. Vitamin B12, we talked about this. This is also available in meat, dairy products, cereals, and soy products. Vitamin C. Vitamin C is in citrus fruits, juices, peppers, broccoli, tomatoes, melons, strawberries. If you can't access these foods, which I'm pretty sure all of you can, you can ask your doctors for supplements, or your doctors give you multivitamin help.